Good morning and welcome to UBLUR TV. I'm your host, Brad Harmon, and today my guest is Dr. Trey Rigert with Columbia Pain Management in Hood River, Oregon. Good morning, Dr. Rigert. Welcome to the program.
Good morning, Brad.
Thank you so much for joining us. Now, Dr. Rigert, over the past few weeks, you've been talking a little bit about the changes in Vicodin and how it's becoming a Schedule II substance. I hear there's been an update in the law. Can you tell us a little bit about its current status?
Yeah, that's a great question, Brad. You know, we know now that Vicodin is going to be in the same category as OxyContin and methadone and fentanyl, so we've recognized that there's a danger, significant danger of abuse and diversion. We had some concerns about whether people would be able to get the refills. If they'd had a prescription written in July for 6 refills, would they be able to get those after October 6th, which is the date the medicine becomes a Schedule II? We've had guidance that those refills will be valid until April 8th of 2015. So if you have a script that was written before October 6th with extra refills, they will be refillable out through April 8th, 2015. Now, there are pharmacy chains that may not honor that. This is just the guidance that we have from the federal government, the DEA, the regulators. It's recognized that some of the computer systems may not be able to parse the scripts into 2 clumps. So it's conceivable that even though it's possible, it may not be possible for you. So the other part of this was communication between the patient, the physician, and the pharmacist is critical so you can have access to your medicine after October 6th.
So that's actually good news for those people that have been using Vicodin for long-term chronic pain, because now they don't have to have an immediate decision made by October 6th. They have some time to make some choices. That's correct?
Absolutely.
That's good news. So, Dr. Rigert, if someone has been using Vicodin for long-term pain management, and because of the changes in the law, they want to make some changes in the way they're treating their pain, what kind of choice do they have if they no longer want to use Vicodin as their main source of pain management?
Yeah, we talked a little bit about that earlier. Now's a good time to kind of sit back and think and maybe talk to your family, your friends. You know, has this medicine really done what it was supposed to do? Because this is a recognition that there's extra risk with hydrocodone containing products, and that includes Norco and all the other different flavors of Vicodin. So if the medicine isn't right for you, it's a good time to talk to your provider about what to do. For the folks that maybe aren't able to get that guidance, I would like to point out, just kind of remind everybody what withdrawal looks like, because sometimes, actually fairly frequently, we have people come into clinic who say they stopped their medicine and they had a really bad cold and they feel horrible for 2 weeks, and they don't recognize that as withdrawal. So if you stop your medicine, your hydrocodone, you're going to have some symptoms. You're going to have some runny nose, some yawning, some nausea, some tremors. You're going to have problems sleeping. You're going to feel like you have the flu. Your back is going to hurt. You're going to have some depression. And if you've been taking a lot of Vicodin for a long time, those symptoms can go on for quite a while. You can have acute withdrawal where you're really miserable for a few days. And you can have post-acute withdrawal where you just kind of feel blah that can go on for weeks, and for some people for months. So your option is to wean yourself off the medicine. It would be better to have help. There are some things that you can do on your own. The first thing is to recognize the symptoms and recognize they will get better every day and every week. That's really the first thing. Some people feel like they're going to feel that way forever, and that's really a bad feeling, and if they understand it's self-limited, that helps them get through it. Things like Lomotil can help with your GI upset. Benadryl can help you sleep. There's a lot of other tools out there for the pain part. There's not a ton of other tools out there for the withdrawal part, so you really need to work with your provider. There are some prescription medicines that can help people sleep, lift the mood, help people get through it. We try to avoid tranquilizers because then people tend to get dependent on those. But your doctor or mid-level provider can help you. Over the counter, you've got your Lomotil and your Benadryl. But think about it. Think about where you want to go with your medicine. Recognize if you stop rapidly, you're going to have some symptoms, and seek out help if at all possible.
So it sounds like the DEA has decided that this is a very important subject that they needed to have a discussion about. So if you've been on that treatment, it's time for you to have that important discussion with your provider and see if it's really the best source of management for you.
Yeah, great time for a deep breath and a re-examination.
Excellent. Well, Dr. Rigert, we very much appreciate your counsel and advice on the program today, and we appreciate you as viewers tuning into the broadcast, and we hope that we'll see you again soon on another show.